Hello everyone, I'm Simrjeet, registered nurse again. So today I'm going to discuss about the oxygen method, that like how we are delivering the oxygen during emergency and in other conditions. So firstly is nasal cannula. So nasal cannula, we using the oxygen like 1 to 6 liter through the nasal cannula. So is delivering the oxygen like 24% to 44%. So in this the intervention what we are doing, like make sure the skin integrity, like whenever we are using nasal canal for the patient, we need to be assess for the skin integrity into the nares. So if there is anything in during the like when we are watching or when we are assessing the any skin integrity damage, so we need to use for the water soluble jelly to the nares as prescribed by the doctor. So next one is a simple face mask. So simple face mask is using for the also for delivering the oxygen, and how much percentage in using for the simple face mask is 40 to 60% oxygen we are using through the simple face mask. So in the simple face mask, what are the intervention, like we need to be make sure like all the straps are tight and fitted, and the mask is fitted properly to the nose. We need to make sure when we are using the simple face mask for the patient. So next we are using the partial rebreather mask. So partial rebreather mask is using for the patient who need oxygen 70 to 90%, and in this in the partial rebreather mask there is a reserve reservoir bag also attached to the partial rebreather mask. So in the intervention, that's very important, like we need to make sure the reservoir bag is full to third of the oxygen. Why it should be 2/3 full? Because whenever the patient is taking the oxygen, so that he can take full oxygen, if the reservoir bag will not for 2/3 full in the partial rebreather mask, then the patient will take the his or her own expired air, like whatever he will be expirate the air, he will also like inspire that one. So that's why the reservoir bag should be 2/3 full in the partial rebreather mask. In non-rebreather mask, so it's using for the like more than 90% of the oxygen, so it's using in a patient who require the intubation. So in that cases we are using the non-rebreather mask. So face tent, so why we are using face tent? Face tent is also using for the oxygen, is using the patient who have the facial trauma or burns. We're using the face tent so it will not touch the face. So aerosol mask is choosing patient who have the surgery of the airway, or who ever have the thick secretions. In that case, we are using the aerosol mask. So next one is the tracheostomy collar and TPs. It's also using for the oxygen, and is using whoever patient have the tracheostomy, whoever patient have the like endotracheal tube inside, or whoever patient have the laryngectomy. We're using the tracheostomy collar and TPs. And last one is venturi mask. Venturi mask we're using for the it's a high flow system oxygen. We're using the venturi mask, but the mechanism is using in the venturi mask is using the is pulling the environmental oxygen or air also inside. So it's depend like how much is pulling the air, depend on the amount of the liter of the oxygen. So these all about the oxygen method we are using in the hospital and other settings. And what are the NCLEX question can come whenever we are using the oxygen methods? So in the NCLEX question is very important, like during when we are using the simple face mask, what we need to be make sure whenever patient is using, we need to make sure the mask is fit properly and straps are well tighted, so that if it's not if it's loose, then patient can't be take the full amount of oxygen into the respiration into the system, and it can cause the patient the oxygen amount will not be sufficient. So that's why we need to be make sure like patient is mask is fitted properly, and patient can breathe, patient has sufficient oxygen going into the system. So next question is very important as a NCLEX view. Like in the partial rebreather mask, we need to make sure the bag is full. The reservoir bag is attached to the partial rebreather mask. We need to make sure the reservoir bag is full, like 2/3, so that like patient, whenever patient is taking the oxygen, so he or she will not take the expiration air. Whatever he expel out the air, he will not take inside again. So that's why we need to be make sure the reservoir bag is full, like is 2/3 full. So these all about the oxygen method we are using during the hospital and other setting. And please like and subscribe my channel, and see you soon in the next video. Thank you, take care, bye.